Thank you, Mark. We're joined tonight by Dr. Cesar Coelho, a cardiologist with the SIH Prairie Heart Institute. Dr. Coelho, thank you so much for being here with us this evening. Now, I want to get right into it. We hear a lot about COVID-19's impacts on our lungs, but now we're finding it's becoming more of a heart issue too, right?
It's my pleasure to be here, Julie, and it is correct. The viral infection affects the lungs and produces respiratory failure and generalized symptoms in the rest of your body, including in the heart. And it was surprising to most of us in the beginning of the pandemic to see that about 40% of the patients that were sick enough to be admitted to the hospital had markers of heart damage on their blood. And fortunately, those are sometimes very limited and they resolve spontaneously. But some of them will be having more serious heart involvement. And not only heart, sometimes also vascular involvement, as you might have heard. And we see some of that also with the vaccines, but it's a lot more pronounced on the patients sick with COVID.
And what can COVID do to someone's heart?
So in most of the cases, the mild forms are not likely to do too much to the heart, with the exception of some sports stars, I guess, in colleges that were known to have some kind of inflammatory process and scar tissue formation. And fortunately, they have evolved favorably and things have mostly gone back to normal. But in the patients who are very sick in the hospital, they may have problems with situations where they develop a heart arrhythmia, or they may develop weakening of the heart muscle, inflammation of the heart muscle, inflammation of the wrappings of the heart, and complicate a little bit the picture. And in some cases, the other thing that we have seen is people who did not know that they have heart problems might now present with heart problems. And there is also a condition where people who are extremely sick on the mechanical ventilator and so on, they might develop a stress-induced heart damage. And fortunately, some of them respond to the treatment that we have for them. But in some cases, it may not be the case, and makes the malfunction of the lungs even worse. And at the same time, if your lungs are very involved, that's going to put a lot of strain on the heart, especially the right side of the heart, and can produce right side heart failure.
So it all kind of interconnects internally then?
Absolutely. I mean, the human body has these organs, but they are all connected to each other and they have to work together. And if one starts malfunctioning, that is going to produce some strain on the other organs. If your heart is not doing well because your lungs are not doing well, the next thing you run into is the kidneys are not doing well. And as you have more organs involved, your chances of surviving go down significantly.
Wow. And we are hearing, that the heart is a principal target for COVID-19. Are you seeing that with your patients?
We see them quite a bit on the very sick people. About 2 or 3% of the people that are developing an infection may be sick enough to die from that.
Yeah.
The problem is when we have a large size of the population getting infected at once, and that's really what is producing the biggest problem for us.
And now some people, we're hearing reports, some folks are concerned about the effects on their heart after getting the vaccine. Can you speak to that? Are there any side effects, especially people with heart issues should be aware of?
Well, the vaccine itself has been extremely safe for, looking at the population. Now, there will be a few cases where the vaccine actually kind of triggers similar problems than COVID can do, but the proportion is much less. But we have seen in the news, for instance, those cases of inflammation of the heart muscle where, usually men in their 30s or 40s had inflammatory problems with the vaccine, but they were very limited and they resolved spontaneously. And they are not actually very different than the ones we saw with COVID, but the infection tends to have more severe forms and the proportion is higher. So looking at the pros and cons, I think that you're still safer to have a milder form with the vaccine. And that's still very rare, in terms of the chances of you developing that, that's extremely low compared to the actual infection.
And is that where myocarditis comes in? Kind of break down what that actually
So
entails.
myocarditis is a medical term that indicates that there is inflammation of the muscle of the heart.
Okay.
And that really is part of the problem that we were discussing, just the medical term we use for that.
Okay. And for your patients, who might have underlying heart conditions, do you recommend that they get the vaccine? Is there anything they should be aware of before getting the shot?
That's interesting. So we do have some experience with vaccines and heart problems. And there is some aspects of that are not very well understood, but they are recognized. And for instance, we're approaching the fall, and every year, since you probably have memory, we have vaccines for influenza, for the flu. And heart patients who are vaccinated against the flu, they tend to have a much better survival and less heart attacks. So we think that the inflammation that happens during that infection with the flu tends to favor the formation of events like heart attacks.
Yeah.
Therefore, having the vaccine makes sense that might reduce those. Well, that is not very different than what we see with COVID. So in fact, instead of saying, yeah, it will be okay to get vaccinated, it might be very important that the heart patients get vaccinated to get the best chance they can, if they were to develop the infection.
And we're talking a lot about folks who, get COVID and, hospitals are overwhelmed right now. I guess my next question, focusing on folks having to forego elective procedures, what can that mean for someone who, needs cardiac work done?
Yes, and I think that's actually one of the biggest concerns. We have hospitals that are strained in terms of not having beds, and staff that is overworked. And when you have those situations, you tend to have less safety and less quality for the routine procedures. And at some point, like in our case now, we are not being able to deliver procedures that require an ICU bed.
Yeah.
So if you were to have a procedure that required that you be in an ICU following the procedure, that's really not available. So if it's possible, we delay that until at a later time and hope that no complications arise. Or if it's an emergency, we have to be finding a place where to send those patients. And in some cases, it has been very difficult to do that. And I would not be surprised that we have increased mortality. Actually, some of the research in the world is showing that there is secondary mortality that is indirect to the actual infection of that patient. Didn't have an infection, but is suffering from the fact that services are not available, or nurses are not available, or the nurses and the emergency room that you go to, they are overwhelmed taking care of these other patients that are sick.
The other patients. And what is an EMCO procedure? Am I pronouncing that right?
The ECMO.
ECMO.
The ECMO. So the ECMO, if you imagine somebody having a mild form of, let's say, COVID, they don't really need anything, right? A little Tylenol, hydration. If somebody gets a little sicker, they might need oxygen, and they start getting the treatment for that condition. And we do have several treatments available. If they still get sicker, they might actually have a need for high flow oxygen, a little more advanced technology, delivering the oxygen to the lungs. But once the lungs are totally destroyed by COVID, which unfortunately happens, or the heart is having severe failure, then this machine is called ECMO, will be connected to the patient through special systems that access the veins and the arteries, and then they take the blood out of the patient, oxygenate the blood in the machine, and then put it back on the patient. So it's like giving him an artificial lung or an artificial heart for a temporary, period, and try to keep them alive. I mean, you reserve these for people who really have no other option, and before ECMO, they will just have been, dead. Yeah. So the ECMO gives them, a little chance of maybe 50% or so of surviving, and we have ECMO available in our region. Our group has been able to actually take care of several patients with ECMO, and some of them have had a good recovery. But once they have the ECMO, they have to go to a higher level of care.
Pretty serious then.
Transferred to different hospitals, and usually St. Louis or Nashville and so on.
All right, well, Dr. Coelho, I want to thank you so much for joining us this evening. You've been very informative. We really appreciate it. We will have this entire COVID conversation on our website, WSILTV.com.